What are all surgical options for hearing loss? Imagine a world where hearing loss no longer limits your ability to connect with loved ones or enjoy your favorite sounds. There are several surgical options designed to help restore hearing, but which one is right for you depends on your specific condition. Let's explore the main surgical treatments available for hearing loss, based on scientific and medical guidelines. One common procedure is the stapedectomy, which is used to treat otosclerosis. This condition causes abnormal bone growth around the stapes bone in the middle ear, preventing it from vibrating properly. During the surgery, the surgeon removes the immobilized stapes and replaces it with a tiny prosthetic device. The procedure usually takes about 90 minutes and can be done under local or general anesthesia. Most patients go home the same day, and hearing improvement often happens gradually over several weeks as swelling decreases. Another option is ossicular reconstruction, which is similar but broader. It involves repairing or replacing damaged middle ear bones, called ossicles, with prosthetic parts. This helps restore the mechanical pathway that carries sound from the eardrum to the inner ear. This surgery is especially useful when multiple bones are damaged or missing. For fluid buildup or infections, doctors may recommend a myringotomy with tube placement. In this outpatient procedure, a tiny incision is made in the eardrum to drain fluid, and a small ventilation tube is inserted. This helps equalize pressure and improve hearing, especially in children with chronic ear infections. The tubes usually stay in place 4 months or even years before falling out naturally or being removed by a doctor. Tympanoplasty is another surgical option that repairs perforations or damage to the eardrum. It involves reconstructing the eardrum and sometimes the middle ear bones to restore sound conduction. This procedure can help improve hearing and prevent recurrent infections. In cases where the mastoid bone behind the ear is infected or diseased, a mastoidectomy may be performed. This surgery removes the affected bone to control infection and improve middle ear function, which can help restore hearing. For individuals with severe to profound sensorineural hearing loss, where inner ear hair cells are damaged, cochlear implant surgery offers a different approach. The surgeon implants an electronic device that bypasses the damaged hair cells and directly stimulates the auditory nerve. The device has an internal receiver placed under the skin and electrodes inserted into the cochlea. An external sound processor captures sounds and sends signals to the implant. Post-surgery, patients often undergo rehabilitation to maximize their hearing and speech understanding. Bone-anchored hearing aids, also called bone conduction implants, are another surgical option. These titanium devices are anchored to the skull behind the ear and transmit sound vibrations directly through the bone to the inner ear. They are especially helpful for people with single-sided deafness or conductive hearing loss who cannot use traditional hearing aids. Some individuals are born with malformed or absent ear canals, a condition called atresia. Reconstructive surgery can create or open the ear canal, repair the eardrum, and rebuild ossicles to improve hearing. These procedures are tailored to each person's anatomy and needs. In cases of tumors affecting hearing and balance nerves, such as acoustic neuromas, surgery may be necessary to remove the tumor. The approach depends on the size of the tumor and whether preserving hearing is possible. Surgeons may use techniques like the translabyrinthine, retrosigmoid, or middle fossa approaches. These surgeries requiring careful planning to balance tumor removal with hearing preservation. Lastly, labyrinthectomy involves removing the balance portion of the inner ear. While it is not used solely to improve hearing, it may be part of treatment for severe vertigo or vestibular disorders. This procedure results in total hearing loss in the operated ear but can help control debilitating dizziness. Overall, surgical options for hearing loss are diverse and tailored to the individual's diagnosis and needs. Whether repairing middle ear structures, implanting electronic devices, or reconstructing the ear, these procedures aim to improve hearing and quality of life. It is essential to consult with an otolaryngologist or hearing specialist to determine the best approach based on thorough evaluation and personalized care. Always seek professional medical advice to explore the safest and most effective options for your hearing health.